Hello. Good afternoon. As Rob said, I'm Marissa Nabholtz, and I'm a very grateful ACH parent. My son, he spent 4.5 months at the NICU at ACH, so this subject is very personal to me. And when I learned about the Alliance, I was very excited because I knew what impact that this could have on the state of Arkansas and to the families here. And so thank you all for joining me today, and thank you all for joining me today on the panel. So let's begin with just some brief introductions. So please just tell me the guests, tell the guests your role, your title, a little bit about your hospital. So Mary, why don't we start with you?
Yes, thank you. I'm Mary Salazar. I'm Director of Women's and Infant Services at Conway Regional. Conway Regional is a 150-bed hospital where we deliver 1,800 babies every year. Our nursery at Conway Regional is a level 2 facility, which means that we don't have a neonatologist on staff, so we rely on our local pediatricians for the care of our babies, and then transfer out to facilities of a higher level as needed from there. We've been part of the Nursery Alliance officially since November 2016.
Okay, and Susan, would you tell us a little bit about yourself?
Yes. I'm Susan Sweat. I'm the manager of Jefferson Regional Medical Center maternal child areas, and we have been a member of the Alliance since March 2018.
Okay, and Marcia.
Hello, my name is Marcia Oliver. I'm the nurse manager at CHI St. Vincent Hot Springs, and we are about a 200-bed hospital, and we serve Garland County and the surrounding areas in South Central Arkansas. We became a member of the Alliance in February of 2018. At that time, we were just thinking about embarking upon a labor and delivery remodel, which we are, and we're also going to upgrade our level 2 nursery, which means that we'll be able to keep our babies on breathing machines and also utilize the protocol that we have for neonatal abstinence. So with this remodel, our partnership with Arkansas Children's is going to be wonderful because we're going to utilize those individuals to help us with partnering and choosing the right equipment, and also the design of the nursery, and of course training of our co-workers.
Okay. All right, Amanda.
Hi, I'm Amanda Autenreath, nursery manager at Ashley County Medical Center in Crossett. We are a small rural hospital. We have a 5-bed level 1 unit, and we average 1 infant per month transferred to a higher level of care. And we joined the Alliance in June of this year.
Okay, and Tracy.
Hi everyone, I'm Tracy Bradley Simmons, and I'm the coordinator for the Nursery Alliance at Arkansas Children's Hospital. And as Rob mentioned, Arkansas Children's Hospital is the only level 4 nursery in the state.
Okay. Well, again, thank you all for being here, and we're just here today as, we're going to have an important conversation about the ACH Nursery Alliance and how it's making infants better today and giving them a healthier tomorrow. So through my personal experience with my son spending time at ACH, I know how important firsthand the work that you all do is on a daily basis. And I was so excited to have you ladies here with us today to just talk about it. And as we move through our discussion, you guys will see, and you behind me on the screen, we're going to have a word cloud that will be building. And it's just going to be illustrating the impact that we're having on children's health in Arkansas. So Mary, since Conway Regional, you guys have been a member of the Alliance the longest. So I'm going to start with you. And could you just share with us a few tangible benefits that being an Alliance member has offered you all?
Yes, ma'am. When I first joined Conway Regional about 4 years ago, there was some obvious needs that we had in our neonatal care there, and the Nursery Alliance has given us the opportunity to really assess those needs, to develop some goals, develop clinical guidelines for our team, and to help achieve those. Early in our relationship, Dr. Ashley Ross, Director of Neonatology at Arkansas Children's Hospital, spent a full day with us in our nursery. He attended deliveries, spent time in labor and delivery. He provided us some feedback, identified our strengths, helped us identify some opportunities for improvement that we had. One of the biggest issues that we had initially had to do with intubation of premature infants. When I first arrived, when we looked at our intubation skills, It would typically take us about 2 to 3 times attempts to get a successful intubation of a very small premature infant. And then half the time we were unsuccessful totally, and we had to rely on other methods for ventilation for those infants. And so with the help of the Nursery Alliance and the guidance from Dr. Ross and the Children's Hospital team, we identified the need for a CMAC laryngoscope, which is a video laryngoscope. The CMAC device would allow us to have better visualization and be able to intubate a lot easier. Dr. Ross came up to our institution, did some education for our staff. Dr. Whithall also visited our hospital, did some education for us and on how to use the CMAC with the respiratory therapy group and our physician team. And with that device and the education that we received, we saw our success rate of intubation increase dramatically. And so it really gave us a higher level of skill, and it increased, most importantly, that confidence that the team had. We also had some training on neonatal abstinence. Before the Nursery Alliance, many times we would have infants who were exposed to drugs, legal and illegal, during the pregnancy, and then also had those in their system after birth. And so traditionally what we had done, we really hadn't done a very good job at all at assessing an infant that needed to be assessed. We often sent those babies home before they even started to have symptoms. And if they did have symptoms of withdrawal or neonatal abstinence, we often, all the time, transferred them out to another higher facility, to a NICU. And so with the education that we received from Children's Hospital, some guidelines and protocol for neonatal abstinence, we began to assess our infants and then also treat those infants. And now, routinely, those infants remain with us, and that helps the family and the child stay closer to home.
Oh, thank you, Mary. And as a mom who had a son that was resuscitated at birth, that really just that intubation and being more successful the first time, that is great. And also, you mentioned Dr. Whithall. He was one of Caleb's first doctors at UAMS before he was transferred, so lots of love for him. I promise I won't cry today, Fred. I'm going to be known as the town crier if I don't get it together. So I'm good. So I know that all of you have agreed that the training and education offered to the Alliance members is one of the greatest benefits. And Mary, you mentioned several examples of clinical training, but it's not just limited to that. And Susan, I think you could tell us a little bit more, because I think you guys at Jefferson have set in place some injury prevention goals. So would you tell us a little bit more about that?
Yes, when the Alliance came, we all had goals, and one of our first areas of improvement that we identified was expanded education and training in car seat safety. Too many of our new parents, they don't have the appropriate car seat, or if they did have the appropriate car seat, they didn't know how to install them when they left the hospital. So there was a lack of knowledge about the proper installation. So being a part of the Nursery Alliance gave us access to car seat training and educational materials from the Injury Prevention Center at Children's. We quickly realized the value of having more car seat technicians on our team, and after partnering with the Alliance, we have added 2 more car seat technicians. Also, we were impressed with the safety baby shower program offered through the Injury Prevention Center. And we have mothers who receive education once they go to the baby shower. They receive education on home safety, safe sleep, motor vehicle safety, and prevention of the shaken baby syndrome. We are currently working with the Injury Prevention Center to incorporate the educational sessions into our classes for the expectant parents.
So thank you. Very important work you guys are doing. And we've been hearing a lot about the sharing of best practices, educational resources, and training. But I know Rob touched on this in his introduction, but it's not just that Arkansas Children's Hospital is the teacher and you all are just strictly the students. I think that one of the great things is that there's been a giving and taking of information. And so, Marcia, I know your team at CHI St. Vincent's in Hot Springs, you actually introduced Alliance members to a new nursery protocol. So tell us a little bit about that.
Yes, Dr. Ashley Ross also came to our institution and did a needs assessment, and at that time was talking with the lactation consultant and realized we had implemented a protocol for glucose gel. This is for neonates that have a low blood sugar, which also can be one of the leading causes for them to go to a NICU. And with that, we would have to supplement with formula, or we would also have to maybe even start an IV, which is invasive. And it would affect the exclusive breastfeeding. It also would decrease the bonding with mom and baby. So he reached out to us, and we shared that protocol with him. So with that, it means that we take the glucose gel and put it in the baby's mouth, in their cheek, and they absorb that, and it helps us with decreasing the use of formula and also the IV fluids. And it also, with this, it has decreased the amount of transfers that we've had to a level 3 or a level 4 NICU. We're able to keep those babies and moms close at home, and that's what our goal is. Dr. Ross also partnered with our lactation consultant and Dr. Zane Henley, one of our pediatricians, to train the teams at UAMS, at Children's Hospital, and our other alliance partners.
Yes, we've been using that for a few weeks now.
We also started about 2 months ago and having really good results with it.
So it's not only that the Alliance, that Children's is giving us information, we're sharing throughout all of this, all of the best practices, and we're going to be sharing that throughout our Alliance.
So that's great. And I was thinking I learned something new today too, because I did not realize that that was one of the leading causes of admission to the NICU. So teaching us all something today. So, Amanda, you are Ashley County Medical Center in Crossett, and you guys are kind of known as like the new kids on the block, so to speak. So tell us a little bit about the goals that you guys have set for your first year of partnership.
Okay. Overall, we are looking for training for our staff. We are in a very small rural community, and we want to be able to provide our families with the high quality care that people in Little Rock get here at Children's Hospital. So we have very few resources, so we're looking for ways to provide high quality care with fewer resources. And hopefully the Alliance is going to be able to help us with training our staff to achieve that. One of our concerns has been breastfeeding rates. They were pretty non-existent about 5 years ago in our area. We've been working to improve that and have made some great strides with it. We've improved our results quite a bit, but we've kind of hit a plateau. So the Alliance hopefully is going to help us train our staff to be able to help the moms be more comfortable with breastfeeding, and over time a whole community shift on infant feeding. And we're looking really forward to the Alliance helping us with all those goals for this year.
Well, I can't wait to hear you guys hit those goals and then just keep going from there.
Yeah.
So it'll be great. And Tracy, I want to kind of hear from you because you're the coordinator of the Alliance. So you kind of have a unique perspective being the liaison and working with each of them. So you joined ACH after the first 3 Alliance members were on board. So what are 1 or 2 things that make you the most proud of the Alliance and your partnerships with the members?
Sure. Well, I think it's exciting to see the exchange of knowledge between the partners because Arkansas Children's Hospital has access to neonatologists and pediatricians. We're able to receive research and resources a lot earlier. And through the Alliance, we're able to share that information with our partners and make sure that they're just as up to speed as we are. Just last week in a meeting with JRMC, Dr. Ross was able to share updates to the body cooling protocol. The state of Arkansas leads, and Arkansas Children's leads that protocol and procedure for the state. And so he was able to share those updates and get that out to JRMC so that we're all on the same page. So that's really been exciting. I think another area of excitement has been the unique position that Arkansas Children's is in to lead such an important initiative, whereas across the nation, usually a collaborative such as an alliance is led through something like a Department of Health or some similar organization. And so because the Nursery Alliance is voluntary, and we are working within the needs of each organization, that's been exciting to see as well, and I think that's something that we all can be very proud of.
Absolutely, and to me that just shows that you all are all taking, just that ownership of you're not waiting for someone else to do it, and no one is making you do it, that you're volunteering and taking that ownership of the children that are in your care. And so I think that says a lot for you guys and what you're doing, and hopefully it just continues to grow. And so, all right, we have time for one more question. So Mary, I'm going to turn back to you as our veteran on the panel. So could you please share some advice for our newer members? And is there one moment you can point to that just best exemplifies the impact that the Alliance has had for Conway Regional?
Okay. My advice to new members is that what you get out of this partnership with Arkansas Children's is really up to you. When we first started to develop the Nursery Alliance and talk about it, we had to spend a lot of time educating our team of what exactly is a Nursery Alliance and what did it actually look like. Some people actually thought that Children's Hospitals was going to come in and work our nursery and take care of our babies and do all the work on the ground floor. But that's not what this partnership is about. It's about a collaborative. They're not going to come in and work. They're going to help train. They're going to help educate. They're going to provide resources, access to policies, procedures, to best practice. And then they're going to help you with a lot of just initiatives that you develop. It's very flexible. But you have to drive that train. It's really up to your individual team on the ground to make those goals happen with the support of the Nursery Alliance. So you set your goals and then you just make it happen from there. I think one of the big defining moments for me as a clinician and why when the aspect of the Nursery Alliance came up, why we really felt like this is really something we need to do, was that when I was fairly new to Conway Regional, I walked into the nursery one day and we were resuscitating a very small premature infant. My physician was there, there was nurses, respiratory therapy, and I continued to hear the statement, I think I hear the helicopter. I think I hear the helicopter, repeated over a 45-minute time period. And the helicopter they were referring to was Angels from Arkansas Children's, Angels 1. And so, as you can tell, since it was for over 45 minutes, many times it was not the helicopter that they were hearing. And they were trying to intubate this infant, which was very difficult. We ended up having to use an alternate method for respirations. But I kept hearing that, and I think that's it. I think it's the helicopter. And so we had that mindset that someone else was going to come in and swoop in and protect and take care of our infant and save our baby. But that was our baby, and we needed to save our baby and our family. And so a lot of our initial first-year goals with the Nursery Alliance were based on that goal to get our team to the place where we were confident and we had best practice that we were able to have a seamless line of clinical care from delivery to stabilization, resuscitation if needed, and then to transport if that was needed for the infant or not. And so that really was a driving activity that really kind of, I don't want to say it scarred me, but it put an imprint on my heart of, we really need that Nursery Alliance to help support us. And our families and our babies are much better because of that relationship that we have now.
Oh, absolutely. And I know the parents have to appreciate, again, that ownership that we can do this, we can provide a high level of care. These children are in our care. And yes, that's just so incredible to all of you. So congratulations to each of you for what you have already accomplished and what you will continue to accomplish. And I think as you see on the word cloud behind me, you can just see so many examples of what the work of the Alliance means to the families in our state. So I didn't cry. Maybe just choked up here and there, so we made it through that. So we do have a surprise for you guys today. So Marcy is going to join us on stage. So Marcy, if you'd come in.
Good afternoon, everyone. How are you today? Thank you all for being here today. On occasion, the Arkansas Children's Foundation has a wonderful opportunity to recognize spectacular work across our state. We present the Dr. Betty A. Lowe Award to honor an individual or a group who's making a significant impact on the lives of children across Arkansas. Past recipients include First Lady Ginger Beebe and the outspoken advocate Ann Hickman. So turn your attention to the screen, please, so we can celebrate our original members of the Nursery Alliance as the 2018 Betty A. Lowe Award recipients.
Researcher, educator, clinician, and administrator. Dr. Lowe was a pioneer in pediatric medicine. In celebration of Dr. Lowe, Arkansas Children's Foundation gives the Betty A. Lowe Award to an individual or group who has made a significant contribution to the health and well-being of the children of Arkansas.
In one word, it's vision. Nursery Alliance came into being through a convergence of recognizing the impact that we could make, particularly on infant mortality, but babies in general across the state. By partnering with the nurseries around the state, what we can do is coordinate the efforts that we have at Arkansas Children's with the efforts that the hospitals have to improve the health of children. And that's the reason why it all came into being in the first place.
What we're looking at is having the Alliance bring in excellent evidence-based medicine that we can apply. We also hope to encourage more patients to see Jefferson as their facility of choice in regular neonatal care. And then when we need to, we can always have the referrals to Arkansas Children's Hospital.
So the best way that we can improve child health is to partner and to bring the care close to where they live, learn, and play. For babies, it's actually where they're born.
Going out and being proactive, not waiting for folks to come to us when they need our services, but really elevating the understanding of how to rear children and really prevent infant mortality, decrease those rates, and again, make the communities healthier. Through that growth, we'll be able to touch more lives with St. Vincent and touch more lives with Arkansas Children's.
The staff at Conway Regional and our nursery and labor and delivery is honored to participate in the Nursery Alliance with Arkansas Children's Hospital. We've been retrained in neonatal resuscitation, on respiratory care. So to me, an educational component that we share both with physicians, nurses, has been a big part of the Alliance with Arkansas Children's Hospital.
I'm excited about the opportunity that Ashley County Medical Center is going to have in a relationship with Arkansas Children's Hospital and this Nursery Alliance. And we want to do everything we can to improve the care of the children that are born here. If there's any issues, and collaborating with children's and the technology and the protocols and policies and relationships with our medical staff and your medical staff and our nursing staff to help patients, to help the babies.
These organizations came together, saw the vision of what it would take to really move the needle on infant health across Arkansas and to do it together. It's not just the fact that they saw it, they actually acted on it and came together, coordinated efforts, put the resources to actually make it work, and are running with it. Dr. Lowe had a passion for children, and specifically Arkansas's children. I can't imagine a better way to honor her than to give this award to the Arkansas Children's Nursery Alliance first members, because they're doing such great work for the infants of Arkansas.
So, if I could ask each of you to please rise, and on behalf of the Arkansas Children's Foundation Board of Directors, I'd like to recognize each of your hospitals with the 2018 Betty A. Lowe Award. Thank you for your commitment and your hard work to champion children through the Nursing Alliance.